Hello, my well-being buddies. It's me, Steve, the mental health nurse, and today you can see we are talking about all things ADHD or Attention Deficit Hyperactivity Disorder, or you may just have heard it as ADD, where we drop the hyperactivity bit and we just have it as Attention Deficit Disorder. So we know it's on the increase. I'm sure you've heard everyone going, oh, everyone's got it. And it just undermines the struggle that people actually have with ADHD, because the reason it's on the increase is we've got awareness. We now know what it is. We've got the research behind it, and actually it is a real problem for those that have it. And I understand that people go, but in my day we didn't have such a thing. You did, you were just labelled something very different. You were labelled the naughty child or the child that couldn't stop talking. And the reality is, by not getting early diagnosis and early interventions, we can cause an absolute chaos for the person that has this. So understanding ADHD, understanding what it is, understanding the treatment options and how to manage it is important for two reasons. One, it means that the person living with ADHD functions and thinks just slightly differently to those without it, meaning that they've never really felt that they fitted in the world. And two, certain therapies and certain medication do not work with people with ADHD. They're just not as effective. So getting this diagnosis is really important. But equally, if we look at kind of some of the barriers people face in this education piece, getting an early diagnosis or getting a diagnosis gives you the ability to have reasonable adjustments to excel in the areas of work or study in which you want to do. So let's start off with, what is ADHD? We'll look at some of the causes. We'll explain that. We'll talk about some of the risk factors. We'll discuss the signs and symptoms, because that's important. You need to understand how it's assessed. It can be a long journey in. We need to understand how it can be treated, both medically and non-medically. So, attention deficit disorder is a condition that affects people's behaviour. And again, it's to do with restlessness, concentrating, and impulse. And you may have one or all three, just depending. Symptoms of ADHD tend to be noticed in earlier age because we're much more aware. So schools should be picking this up. However, that's not to say that they have, because a lot of patients that I have seen in my time have all gone through their whole life without it being picked up. But in most cases, it should now be picked up for under the age of 12. So this is a neurological condition from birth, and that's the first important thing. So this is what separates ADHD and mental health, this from birth piece. So equally, the symptoms of ADHD can usually improve with age, and that's because we learn. Unfortunately, we learn the hard way. Everything we do, everything that's being done, it comes across as quite a slow journey in. And people with ADHD may have other problems around sleep and then anxiety. So it's not uncommon to have ADHD and then other symptoms of mental health. So what causes ADHD? Well, ADHD was still unknown. There's still a lot of research. However, what we do know is it is a condition which runs through families. So research has identified that. But equally, there are some possible differences in people here. So other factors can be around being born prematurely before 37 weeks in pregnancy, being low at weight birth, and then people who are smoking or taking alcohol and drugs during pregnancies. Equally, ADHD can occur in people, but has nothing to do with intellect as such, but it can affect people with learning disabilities or intellectual disabilities as well. So causes then could be genetic, birth, preconditions, etc. So what are the risk factors? Well, let's think about it. People with ADHD are impulsive, meaning they're not giving their brains enough time to think scenarios through. That then makes them at risk of poor choices because we're unable to think through all of those things. So there's some really important pieces of information there, taking time to work things through. Equally, people with ADHD, the front of their brain, where the executive memory is, has a chemical called the ACC. Can't remember what it stands for, but it's a chemical that the brain releases to slow the brain down so it doesn't get angry. The problem with people with ADHD, we don't normally release that chemical, meaning we can get angry quite quickly, 0 to 100. So therefore, having to learn to manage that anger piece is quite important. And that's things like meditation, breathing exercises, exercising, distraction techniques, etc. Because again, if we get angry, we can end up in quite a flighty response. People with ADHD can burn relationships quite quickly. People with ADHD sometimes have high dopamine levels, and therefore there is this increased risk of substance misuse, or anything that they do is taken to the extremes. So that could be gaming, that could be drinking, that could be substances. So that's all there. So all of these risks are there and needs to be managed well. So how is it assessed? What is it we're looking for? What are the signs and symptoms there? So it's assessed by 3 areas, if you like. Inattentiveness, and inattentiveness is this difficulty in concentration and focusing. So if you go back to your childhood, ask yourself, was I a bit of a butterfly? Was I easily distracted? Did the teacher say I could do better if I concentrated? If you heard a noise outside, was you just going to look? Now, are you easily distracted? Do you have a problem concentrating? Do you procrastinate quite quickly? Equally, within attentiveness, people lose things. So am I putting my keys and my phone and my purse down? And in my mind, I think I remembered where I put them, but actually I haven't. And that's because I was going so quick, my photographic memory has let me down. I've put it in the wrong place. So that's the inattentive bit. Then we have the hyperactivity and the impulse bit. So hyperactivity isn't this stereotype of just this one thing of a child running around. You know, yes, that could be a symptom, but that's one type of it. Hyperactivity can also be fidgeting, tapping, rocking, self-soothing, and lots of other things around the speed of the brain and how you're working. And impulsivity, do you end up doing things and saying things without thinking? If you do, then we've got the impulsivity bit. So there's those 3 areas in which we look at. So the form of ADHD or the attention deficit disorder can go unnoticed because these symptoms are less obvious, and they're less obvious in girls over than boys. And that's because girls do this wonderful thing where they can mask it, they can hide it and project. Boys, on the other hand, a little bit easier to diagnose because they just haven't really got that level of masking. Again, a lot harder to diagnose in adults because we've learned coping skills and resilience skills, and we've learned the hard way, and we've made all our mistakes. So there are reasons why it can go unknown. So let's go to some of these signs and symptoms here. So inattentiveness then, have you got a short attention span? If you're watching this video and you make it to the end, you've done really well if you've got ADHD. But that's because you're hyper-focused, because you're learning something that you want to know about. Do you make careless mistakes? For example, do you rush something through and just go, look, that's fine? Can you appear to be forgetful, or do you lose things? So again, really good at problem solving, big picture, but it's that little piece around forgetting things or losing things, happens all the time. Are you able to stick to tasks? Now, what that means is you don't procrastinate, you can set things forward, you get your wheels in motion, and you get it done. Do you constantly change your activities or tasks? So have you had lots of jobs? Do you find it difficult to follow one set of rules and one set of routines, or have you got to do many? And then finally, do you have difficulty organising tasks? So for inattentiveness, when we assess you, we're looking for at least 6 of those symptoms there. When we go to hyperactivity and impulsivity here, it's a combination, the two go together. And therefore, do you find it difficult to sit still? Do you find it hard to watch a movie? You're getting up and down. And equally, if you are watching that movie, are you concentrating on it, or is your brain going 100 miles an hour? Are you thinking, what am I doing tonight? What am I doing tomorrow? Are you constantly fidgety? So you're moving around a lot. Are you unable to concentrate? Do you have excessive movements? Do you have excessive talking? Are you unable to wait your turn? Are you able to act without thinking? Do you interrupt people? And do you have no sense of danger? So again, if you have all of that, again, 6 or more, and you're looking at hyperactivity and inattentivity there. Now, it's important to recognize alongside that, certain mental health conditions overlap ADHD. And the ones that overlap are anxiety disorders, ODDs, optional defiant disorder. So that's where we end up being negative and disruptive towards authority. We might have depression, sleep disorders, autism, ASD, dyspraxia, epilepsy, Tourette's, and dyslexia. So there are overlapping conditions there as well. And some of those are neurodivergent. So again, ASD, epilepsy, Tourette's, all neurodivergence. So symptoms in adults then with ADHD, we're looking at ways in which we can help sort that all out. And that's going to be things around managing organization skills and focusedness and really trying to manage some of their feelings. And what I tend to find is people with mental health disorders who I've seen in the past have said, oh, look, I've been taking this for years. It doesn't work. I keep telling my doctor it doesn't work and nobody's listening to me. And that's because we're treating symptoms and not the cause. So again, other problems that are closely linked to ADHD. So this is why it's really difficult to diagnose. Personality disorders. If we've got ADHD, let's say it links there. Personality disorders are just like one step close to it. Bipolar disorders, that's those highs and lows. Again, a lot of people with ADHD think they've got a personality disorder, think they've got bipolar because of these highs and lows. And OCD, so obsessive compulsive disorder. And around that, it's the thinking, it's the rapidness, and it's the repeating tasks, almost going around and around doing the same thing over and over again. So lots of things to think about there. So the way that ADHD is diagnosed is, first of all, you will need to do a self-assessment tool. So the self-assessment tools you can find on www.adhd.co.uk. So that's the national website for ADHD. There's an electronic tool on there, which you can fill in. So you can do the self-assessment and it comes up with a PDF. Get that PDF, email it over to your doctor and let them know and just say, look, I think I may have ADHD. The doctor then should do a piece of work around you, and they're going to ask you questions about your symptoms from a child. When did it start? What were you like at school, work, or at home? How does it affect your day-to-day? How does it affect your family? And about any other health problems. And they will use that for a referral. So they have to prove when they do a referral to neurodivergent services that you meet those criteria. If you do, then generally what happens is they'll do a referral and then ultimately you're referred up to secondary care. Now, you are going to hear horror stories such as there is such a long waiting list. And if that's the case, you do have the right to choose the right to choose route. So again, on ADHD UK's website, there's a paragraph, there's a page that says the right to choose. If you click on that, it explains what that means. And in a nutshell, what it means is you have the right to go privately, but paid for by the NHS on the grounds that you can prove your ADHD affects you in those ways. And it will speed up that piece of work. So that's what happens there. So once you go through that piece, basically what happens is the psychiatrist or the person assessing you, so that could be a specialist nurse, it could be a psychiatrist, but somebody with the appropriate healthcare qualifications and training, they will do your medical history. They will look at your self-assessment. They will look at the DM5 and ICD-11 signs and symptoms, so you do meet the criteria. They will do a threshold check on that list that we just talked about being childhood and above, etc. And then finally, they will do some kind of psychology assessment with you. So, for example, there's different ones out there. There's like Brown's or Connor's, and they're clinical assessment tools which help diagnose. And basically, you get issued lots of questions, and at the bottom of those questions, it adds up. And normally, it's a score about 60 and above, and then that helps formulate this diagnosis. So it's a combination. Now, it differs with children because it's all of that, plus we then get feedback from family and teachers as well. So that comes in. If you end up with a borderline diagnosis, there are other assessments out there. And these assessments you can do, and they monitor the micro movements of the body. So basically, it's an assessment that will pick up any slight movement and it records it, and therefore the person diagnosing you will see, are you subtly moving, and does that really affect you in this particular way? So diagnosis is, or a diagnose in children and teenagers, then we need to show that the symptoms have lasted at least 6 or been continuous for the last 6 months. It must have started before the age of 12. You must have it in at least 2 different settings, so either homeschool or wherever you are. It must show that the symptoms are making it difficult for you for your social life, academic life, or whatever you're trying to do. And then that the symptoms are not part of another disorder. And again, that's very similar diagnosis for adults, where you will have those checks. And what they're more interested in there is, are you underachieving at work or in education? Is it dangerous for your driving? Do you need some support there? Is it hard for you to keep friends? And is it hard for you to maintain relationships? So that's the diagnosing here for ADHD. So we then move into treatments, and ultimately, treatment for attention deficit disorder can help relieve the symptoms and just helps you to manage the day-to-day. So natural ways of managing this are things around, it's a process called psychoeducation. And psychoeducation looks at coping skills, resilience skills, managing anger, managing sleep hygiene, problem solving, and they'll teach you techniques just to slow the whirling down and the brain down a bit. And that's psychoeducation. You may have therapy such as CBT or a behavior therapy. But again, it's really important to have it ADHD focused. So if you've had therapy in the past, you thought, oh, it's not worked, it's probably because it wasn't ADHD focused. And with ADHD, we have a very strange way of thinking. We want to know what it is you're telling us to do and why we're doing it, and then we'll probably be a bit more compliant. So again, behavior therapy looks at the ways of managing that. There are programs out there to help parents manage their children. And again, that's really important because it can be difficult looking after a child with ADHD. So you'll get specialist tailored support there. It might be social skills training. So this is where you do lots of role play and teaching people to manage their symptoms better in a social situation. So for example, not talking, waiting your turn, trying to manage this frustration that's building up inside. Other possible ways of managing it then is diet. So cutting out foods that will trigger the symptoms and make things worse. And again, talking to your GP, looking at dietitians and getting health around different ways of managing that. Supplements, so looking at different vitamins that can work there. So it's things like your omega-3s, your fatty acids, and they can all help and be beneficial for people with ADHD and reducing those symptoms. If you're a parent looking after a child with ADHD, then getting the right social support around you is going to be important as well. You may need an educational support plan at play school or at school. You might need support in understanding how the medication works. You might need support out locally on how to manage your child out when you're out. And there are a list of charities and organisations that can help you. So again, if you go to ADHD UK, you will see a list of charities there that can help you. Now, with regards to medication for ADHD, a GP is unable to prescribe it, and this becomes a bone of contention in primary healthcare because ultimately you've been told you've got ADHD, you feel you've got it, it's definitely a problem for you in your life, and you now want something to help manage it. Ultimately, there are 5 types of medication out there that are licensed to treat ADHD in the UK. And what needs to happen is they have to be prescribed by somebody who is a specialist in ADHD or again psychiatry. What might happen is if you go privately, you end up with which is called a shared care agreement. And in theory, they're meant to work really well because it means somebody from the private sector can prescribe and it just transfers over into the NHS. The problem is a lot of doctors don't yet recognise those shared care agreements. So please make sure if you are going privately that you have a route to get your medication. It is not as simple as what you possibly think it is. Equally, once you are prescribed your medication, whatever that may be, you are going to be titrated on it. And what that means is over a long period of time, the medication is balanced out nice and slowly, so it is prescribed specifically for you. So it's not like off the shelf, 5 milligrams, 20 milligrams. It will be designed specifically for you to help manage those symptoms. Common side effects of the ADHD medication can be things such as blood pressure, heart rate. You might lose appetite, trouble sleeping, headaches, stomach aches, and feeling unwell. And again, things around aggression, dizziness, mood swings, agitation, diarrhea, nausea, vomiting, etc. So there's lots of downsides to the medications. But as I say, if it's what you need and it's what's going to work, then that's really important. So working with then the day-to-day as a parent with a child with ADHD, here's some things that you can do to help manage your day-to-day. So caring for a child with ADHD can be difficult. It can be incredibly challenging and it can be incredibly exhausting and stressful. So making sure that you've got good self-care is really important because if you're not looking after yourself, it's very difficult to look after others. Equally, it's difficult because you need to let other people be aware of kind of the situation you're in. And the problem there is if you've got a child that's quite impulsive, they don't have the time to stop to realise consequences and actions. So things that can help is planning your day. Get the child to understand what to expect from that routine and try and get routine built into the day so it becomes a normal behaviour. For example, if your child is getting ready for school, break it down into structured steps. So, what time are you getting up? Brushing your teeth and hair, having a wash, getting yourself ready, school bag ready, getting your breakfast and getting ready for going out the door. So there's kind of 5 steps there, and breaking those steps down will help plan the day and reduce the anxiety and the stress and the impulsiveness. There needs to be clear boundaries. Okay, so boundaries are really important because if we work within boundaries, we work well. But what we want is a positive behaviour support model. We need you to be recognising the strengths. You know, well done for brushing your teeth. Well done for getting up on time. Well done for getting your school uniform on. Well done for getting out the door on time. And have some kind of praise and reward system there. But equally, if they haven't done one of those tasks, you're able to take something away to reinforce that consequence. You need to be positive, and I know that could be tiring and exhausting, but give specific praise. Instead of just saying general thanks for doing that, you could say, you've washed the dishes, well done, and thank you. Make it really clear that you're building up the positive aspects of what it is you're doing. When you give instructions, make sure they're clear. We have what's called the sender and receiver model here. In your mind, you say something, in their mind, they hear something very different. So, for example, if you are asking your child to do something, give them a brief instruction. So instead of asking, can you tidy your bedroom, say, please can you put your toys in the box? Because their definition of tidying and yours are going to be very different. So again, breaking it down nice and small so they're able to understand. So some kind of incentive scheme. So this can be a reward chart, this can be a behavior thing, but you'll reward good behavior. So for example, behaving well on a shopping trip means that they get extra time on their computer or they can do something. And your chart needs to look at different things, the now, the intermediate, and the long term. The problem with long-term goals in ADHD, it's too far. They're not going to be thinking that far. It'll almost feel like a hopeless goal. Short-term goals work really well because it keeps the mind going and keeps them interesting. You need to be looking for early warning signs. So watch those warning signs, early intervention. So if your child looks like they're becoming frustrated, if they're becoming overstimulated, if they're looking self-control, take them away from that situation and look at calming strategies. So that might be mindfulness, that might be distraction, that might be self-regulating, that might be whatever it is. Try and agree some early interactions there. Social skills. So look at situations where you can teach them good social skills and help them manage self-control. Obviously, don't do something with a child around meal times because, again, if your child becomes tired or hungry, it's going to be difficult for you. Physical activity is really important. So exercise, plenty of exercise, walking, skipping, playing, running, just getting your child to use that additional adrenaline and wear that off. And make sure they're not doing anything too strenuous near their bedtime. Again, you want them coming out of the day mode into the night mode to sleep. Eating. Be mindful on what your child's eating. Look at the certain food groups. Avoid caffeine. Avoid high protein stuff in case of neurofeedbacks and things. So just look at those diets and try and work those out. Bedtimes. So stick to a routine. Make sure your sleep hygiene is tight and avoid stimuli an hour before bed. So no computer games, no phones, no TV. Before bedtime, we need to take the brain, out of the day mode into the night mode. And if you stimulate that brain just a tiny bit, it's going to be firing and it's going to be sending out transmitters that you're in the day mode and it's going to keep them awake. So you might want to do a sensory light on the ceiling. You can get these lamps that shine blue light, which helps regulate their breathing. You might do some of the white noises or brown noises to calm the brain down to help them sleep. And again, you might have some routine, which is just reading a story. Something just to bring them down out of the day mode into the night mode. During the night time, obviously there can be problems, but again, try that routine so it doesn't become a battleground. And again, if you need help, talk to your doctor on that one. And then help at school. So children with ADHD or neurodivergent children should have a SENCO. So there should be a special educational needs coordinator. I don't personally like the word special. I just don't think it's right. It's an additional need. They have an additional educational need. So I think they're just looking at, have we got the right support? And they can be the instructions for the teacher or the classroom assistant. Look, if little Billy starts to look distracted, break that cycle, bring them back. So they're all the things that we can do with children. So now let's talk about adults. So adults with ADHD, again, lots of things to think about here. So first of all, it's about your organization skills. Set yourself reminders, keep a diary, keep a to-do list. Let off steam regularly. Make sure you're exercising. Make sure you're getting that energy burnt off and that you're able to manage that. Look at ways of relaxing And they can be breathing exercises, that could be listening to music, that could be yoga, that could be going to the gym, whatever it is. If you're in a job, talk to your employer about work. So think about what could work better for you. So there's a technique called the Pomorandum technique, and that's where you do a task for 15 minutes and you get a 5-minute reward, a task for 15 minutes and you get a little reward. And what we tend to find, people that are neurodivergent work more so in a vocational field, because actually this distraction and on the go works really well, and we just carry on. If you're at college and uni, look about reasonable adjustments. So this is going to be things about extra time to complete your exams and coursework. If you're a driver, you may need to notify DVLA. So make sure they know. And again, if it affects your driving, you need to talk about that. And finally, think about local support groups and networks, because the more support you have, the easier it is to manage these symptoms. On top of all of that, there are obviously lots of other things that you can do: coping skills, resilience, CBT, apps, and lots of mindfulness stuff. So I hope throughout this, I've given you a bit of an insight into the world of ADHD or ADD. We've covered what ADHD, Attention Deficit Hyperactivity Disorder. Basically, what causes it? It's a neurological condition from birth. Generally, what it means is the left part of the brain, the left cortex, is a little bit softer. As we grow up, it's meant to go hard. In a neurodivergent person with their ADHD, it's still soft, meaning it's not storing all of those rich memories and learning properly, and therefore our emotional regulator is just slightly off. The way that we feel and learn is just slightly off. Nothing you can do about it. It is a for-life condition. Risks, we've talked about: substance misuse, poor risk-taking, teenagers that are undiagnosed potentially put themselves in harm's way. It's really important that we get diagnosed in so we can teach you strategies to keep people safe and avoid trauma. And there's a lot of evidence about ADHD and trauma if you want to research that. Signs and symptoms, we've talked about those 3 areas of hyperactivity, impulsivity, inattentiveness, and we've looked at those ADHD self-screening tools that we talked about. So again, you can go to www.adhd.uk, which is the charity for ADHD in the United Kingdom, and they will give you lots of support. So please have a look at those. And again, with social issues such as bills, housing, and debt, etc. We've gone through how it's assessed, so the self-assessment through to the doctors, through to psychiatry and those screening tools, and the right to choose if you need to. We've looked at some of the natural treatment options, such as the omega-3s and the fatty oils and vitamin Ds and ways of managing that. And we've looked at all of the psychoeducation parts, and we've talked about different strategies for adults and children. And finally, we talked about the fact that your medication, there's only 5 medicines, 5 prescribed medications in the UK that could be used for ADHD, and they need to be prescribed from psychiatry. Your GP can't do it, so there's no point asking them unless they've got an ADHD specialist there. And again, we've talked about some of those signs and symptoms. So I'm hoping that all gives you an insight into the world of ADHD. And I can say on a personal level, the chaos that ADHD causes for people. But equally, I want to say, just because people are neurodiverse does not mean that they're not able to succeed. And I say that because I'm neurodivergent. You've probably picked up on my energy levels. You've picked up on that I'm quite wavy with my hands. And for me, getting this message out about ADHD is a real, it's a real thing close to my heart, because I'm aware of my struggles. I'm aware of how I ruminate and overthink. I'm aware of my boundaries and barriers that I can put up. I'm aware about relationships that I've burnt and lost over the years. And it was only in the last few years that I got diagnosed, and that was because I became a mental health nurse and I was doing all my training, and I was like, oh, all of this sounds like me later on in my life. And since I've learned what it is, and I've learnt to manage it, the symptoms go quiet, everything slows down, and it gives you a chance to see the world. And it means you are able to free yourself from the restrictions that you have put on yourself. So if you do think you're neurodiverse, please do reach out for more support and advice. And again, hopefully, if you've watched this and you want any more information, do just email me and I can send you some more information. Lovely. I wish you all the best of luck. As I've said, my name's Steve and I'm the mental health nurse. Bye for now.